I know you were a personal trainer, strength and conditioning or something.
First a strength conditioning professional and then
Yes.
and personal trainer.
Oh, okay.
They
So
tend to go similar.
Okay, close enough.
Close enough.
But you left that to become a physical therapist.
Correct.
Why is that?
I was working with people mostly with physical limitations and the older population compared to a lot of my associates, right? So all sorts of different types of personal trainers. My emphasis was more on correcting movement problems before they became injuries. And I put a lot of study into that when I was working with elite athletes. And so there tends to be a lot of that at the Division I level where you're basically checking the movement of the young athlete that you're working with, because athletes can be horrible movers, especially if they've had injuries in the past. They're great compensators. And so they learn to move in elaborate ways and perform at a very high level. And that's when the injuries tend to occur. So the idea is to spot the injury problems in advance by checking the athlete at a basic level. How well at a basic level do you move? And then you can figure out what's really going on, identify the problems, fix them before they become injuries, and then you can reduce the risk of injury, and then athletes get to stay in the game longer. So what I did was I applied those concepts and applied it to the general public. I also did my undergraduate thesis on training for leg power in the older population to prevent fall risk. And there's a lot of literature on that. Now that's a component to reducing fall risk, but so I think that basically at the age of 21 is where it piqued my interest about preventing falls in the older population, because we saw the baby boomers were going to come of an age where balance and falls were going to be a significant problem. And where was my role in preventing that problem, especially as someone who was in the strength conditioning world? So did my undergraduate thesis on training for leg power to prevent falls in the older population. So that was at age 21, and then basically went from there. So dedicating my life to empowering people to optimize their movement through their body, right? Because if our body works well, life is a lot easier. If the body isn't working well, life is a lot harder. So that was the focus. So going from that to being a personal trainer who worked mostly with, of course, the general public, but people who are older in the general public and people with physical limitations. So I was already working with people who had strokes or brain injuries or had been in auto accidents, things like that.
How old were you here when you started seeing yourself really focusing on the older community?
About 21 years old.
This was all at the same time?
Yeah, about the same time. And then I started personal training at age 23, 24, 25 is when that was my first career working with the general public before going back to physical therapy school. And why go to physical therapy school? Of course, as a licensed healthcare provider, you're able to do things that a non-licensed fitness professional cannot do.